Well, welcome to this edition of Ethnic Health America. I'm your host, Dr. Mike Lenoir. By now, you all know about the Gulf oil spill. The well has been capped, but there are some ramifications and some very special health ramifications that many people are not talking much about. Today, we're going to discuss those with Ms. Leah Gutierrez. Thank you for joining us.
Thank you.
Tell us a little bit about your background and how you got interested in this Gulf oil spill.
Well, I'm a student at the George Washington University, and I'm specifically interested in global public health. So this project, I was immediately drawn to this project because the public health consequences of oil spills are something that we have a great deficiency in terms of research.
You know, most people, they think about oil as kind of an immediate impact, but there are basically several potential health consequences to people long after. We know from the experience of the 9/11 people that they have had problems ever since, and so cleaning up oil, being exposed to this oil, gives you, it puts you at risk for a number of potential problems. What are some of those problems?
Through my research, I've encountered three major problems, and the most critical populations that are exposed to these are the cleanup workers, because they're exposed to the most concentrated amounts of this crude oil, as well as children, because they have a more difficult time metabolizing and detoxifying the chemicals that they're exposed to. So the major issues are respiratory problems, dermatological problems, and mental health effects, which people fail to take into account many times.
Start with some of the respiratory problems. What can we anticipate seeing in terms of the respiratory tract? Obviously, breathing in this oil couldn't be a good thing.
Right. Well, breathing in the oil in the short term can cause little things such as headaches, dizziness, nausea, etc. But in the long term, a lot of the chemical compounds of oil are very carcinogenic. So potentially it may lead to tumors in the lungs, as well as triggering other serious respiratory diseases like asthma.
And what about some of the dermatologic problems?
Well, again, in the short term, exposure to this oil can cause rashes, but long-term exposure can cause swelling, redness, burning, edema, and what people don't realize is that further exposure to UV rays and sunlight can exacerbate these problems and make them potentially more dangerous.
And one more interesting thing is, what about the mental health problems? Those are often ignored. What has been the experience in major disasters like this with regard to the mental health of the people involved?
Well, this is a major catastrophe for the Gulf Coast communities. People are losing their livelihoods, their homes, and there's been a great increase in depression, anxiety, which leads to mental health consequences, this leads to emotional manifestations and higher rates of domestic abuse, alcoholism, suicide, but it also leads to more physical manifestations like high blood pressure, heart attacks. So it's a huge problem that isn't being addressed.
So there's the primary stress of the whole process and the secondary stress of the chronic exposure to the process itself. Right. You know, do you see any evidence that these kinds of health effects are being appreciated? I just haven't heard much discussion of this in the media.
There really hasn't been enough concentration and focus on these health issues, and the fact is that in the past 50 years there have been 38 major oil spills, and only in 7 of those cases have there been any sort of study done of the human health effects of the oil spills, and so there's absolutely no preparedness for the public health community for a catastrophe of this magnitude.
Now, and this is not the only. There's a big oil spill somewhere in Michigan now. I mean, and it doesn't. These oil spills are not as uncommon as people think. And what about the safety of people who live on these rigs? That's always been a question to me. I mean, how safe do you think that environment is? I mean, how safe could it be?
Well, it's always a great risk, but especially like in the case of the Deepwater Horizon, BP just wasn't taking the precautions to keep their workers safe, and they were overlooking possible dangers. So I think the onus really is on the major corporations to provide as much safety.
And what are some of the steps they could take that would make these kinds of environmental disasters a little bit more tolerable? Because people just start rushing out with boats, collected oil.
Right. Well, what they really need to do is implement sort of insurance policies. In my research, I found statistics that said that it would have cost BP $500,000 to install safety precautions on their rigs that would have prevented this huge disaster that killed 11 of their workers in the explosion and injured 17, but also cost them tens of billions of dollars, potentially more, in trying to fix this whole mess.
Well, we certainly hope that some people who are watching this program will understand the nature of these problems. Obviously, chronic exposure to petrochemicals could not be a good thing, and I think you've done a great job of discussing that. So thank you for joining us.
Thank you so much.
All right, well, we'll be right back after this break.